My name is Sue Grinnell, and I am the director of the Population Health Innovation Lab, which is a program at the Public Health Institute. And we are affectionately referred to as Phil, and I'm absolutely ecstatic to be with you all today and just to share in learning. That's a lot of what we like to do. And I'm very fortunate to get to steward the work with my colleagues of the Population Health Innovation Lab. And we focus a lot on supporting multi-sector collaboratives and their success. Like that's what we are really that's our North Star. And in particular, we've done a lot of work with accountable communities of health, like the backbone organizations. And this slide just highlights some of the work that we do to support ACHs and multi-sector collaboratives. And one piece of work that we're very excited about is our recently completed curriculum, which we have available. Most recently, we just held a web discussion on that. So if any of you are interested, please let me know. Another offering is web discussions. And this discussion today is one of a series of stories from the field of accountable communities for health. And our intention with these discussions are to lift up the great work that's happening in the ACHs across the US. And these stories really highlight the unique approaches to inspire and enhance your current work. And I'm excited, if you want to go to the next slide, to be today with some colleagues from Vermont. And I'm gonna, when I'm done speaking, I will put their bios in the chat so that you have that. With me today is Laural Ruggles, and she is the Vice President of Marketing and Community Health Improvement at Northeast Vermont Regional Hospital. We have Kari White, who's the Director of Quality Initiatives and Compliance, as well as the Privacy Officer, that is a mouthful, at Northern Counties Healthcare in St. Johnsbury, Vermont. And Laural and Kari are here, they are with Northeast K, it's NEK Prosper, ! And it's based in Caledonia and Southern Essex counties in Vermont. And today, they're going to be sharing the background of their approach and how they got there. And I'm really excited because they're going to share some tools that they use to create conditions for success and really spur innovation and highlight a particular project where they've used some of these tools. And the intention, right, is for you all to learn about what they're doing, but also hopefully you can take away these techniques to fuel trust and innovation in your own work. So with that, I am going to turn it over to Kari.
Thank you, Sue, for that lovely introduction. I can speak for myself, and I think I can speak for Laural when I say we are thrilled to be here with all of you. March 24th, it's a big day. Elvis was drafted into the Army on March 24th. It happens to be the International Day of Achievers. It's also National Cocktail Day. So I'm sticking to seltzer-based cocktails because I'm at work today. My boss is on the line, so I thought I should say that. And actually, what's very apropos is this happens to be Education and Sharing Day. So that's something that we're doing together, and we're really excited for the opportunity to learn from you as well and share a little bit about how we've approached our collaborative work in these communities that we live, work, and play, and raise our families, and hope that it's the best community that we could ever possibly hope to live in. So that's where we're coming from here. You can see as we work through, whoops, I gotta go back a slide. We set up our work with intentional purpose. When we bring people together for meetings, we utilize a tool called the 3R Agenda, and the 3 R's stand for resources and relationships needed to get results. So you can see here that this rough sketch of an agenda is segmented into tasks and hopefully the results that we'll achieve together as we're working through this. So we're going to do a check-in just a minute, an interactive check-in. Laural will then set the context for our NEK Prosper collaboration. I'll walk us through our experience using a tool and a technique called the critical response process, which we used to reinvigorate a collaborative project. And then we'll all get to practice that together. So a couple notes, participate to the level and degree you feel comfortable in any of this. It should be fun, especially on National Cocktail Day and National Cheesesteak Day. It is that as well. I did my research. And then please keep track of questions as they arise for you, because we will put them to very good use when we practice the critical response process. So, any questions so far? Any other thoughts, Laural?
Nope. Thanks for joining, everybody.
So I have put in the chat a link to a tool called Mentimeter. And this is a participatory tool to sort of check in and come together around this shared purpose. So you can either open a browser window and go to www.menti.com. It will ask you for a code. So you can see the 8-digit code that's there on the screen. So you would enter that. Or you can follow the link directly in the chat. And that should bring you to a secondary window where you can enter the responses. So I am going to quickly go there. I see some of you are already there. You beat me there. And if you have a split screen, you can see that the first question is what sector you are here representing mainly today. It's in alphabetical order except for the category other, which you can select if you're like, hey, don't fence me in, I'm here, I'm all of these things and a bag of chips, right? So it looks like healthcare is the predominant sector for folks here today. Gonna give it a couple more seconds. Followed by academic education and other. Food, housing, or human services, and government policy. These are both tied. But the predominant sector is healthcare. Oh, we just had a little bit of a shift. Ooh, other. Look at that. I'll leave that up to everybody's imagination what that means. I don't know. Oh, it keeps shifting. So when you do get the slides for this, these will be memorialized, so these will go with the slides. So this is not lost into the ether once you respond. All right, I'm going to forward to the next slide. All right, this is to engage your senses a little bit and get you thinking about what a flourishing system of care looks like, sounds like, feels like. You can enter multiple times. It asks you sort of for 3 to begin with, and it should build a word cloud. The first response has come in, easy to access. Access, passionate, coordinated, woo! Here they come. And the most common responses appear largest. Coordinated, compassionate, easy to access, accessible, responsive to needs, thoughtful, generative, vibrant, simple, easy, motivating, welcoming, unstressful, diverse, patient-centered, community-based, just, loving, not just healthcare, collaborative, productive. I mean, these are beautiful, very hopeful, very optimistic adjectives and verbs and nouns, and it's created a beautiful picture. All right, I'm going to move on. So again, this will be memorialized. And now we're going to play a little game show. So prepare yourselves for this fun overload. You're gonna have to name yourself. Ooh, look at all these players, I love it. Santa's in the house. Yes. All right, I'm gonna start the countdown. Here's the question, where does collective impact start? So your options. 10 more seconds to answer. 3, 2, 1. Time's up. Woo, common agenda. And the answer is trust, urgency, champion, and resources. So there were 3 winners. Let's see if it shows. Oh, that is priceless that Bryn, of all people, won. Bryn is the daughter of the founder of Northern Counties Healthcare, David Reynolds. So this sort of community collaboration runs deep in her blood. So this is not a surprise to me that Bryn won. Thank you for playing. All right. Now I need to get out of this. I hope that was amusing and fun. And I'm going to go back to our slides and let Laural take the story from there, since we have this understanding about where collective impact starts.
Thanks, Kari. So I'm going to give everybody a little bit of a background on our region and who lives here. So NEK Prosper covers the southern half of an area in Vermont known as the Northeast Kingdom, or NEK. So it is a region known for its rugged beauty and independent and spirited people. So we're very rural. Essex County has a population density of less than 10 people per square mile, and Caledonia less than 50 people per square mile. Our population is both declining and aging. So our numbers are quite small for BIPOC and LGBTQ plus Vermonters, but that doesn't mean that we don't have health disparities and that issues of health equity are not a priority for us, because they are. Our health equity concerns are often focused more on things like socioeconomic conditions, gender, age, disability, chronic condition. Single female head of households have long been and continue to make up the largest group in poverty. So in Vermont, like other areas of the county, the adverse economic effects of the pandemic have impacted women more than men. There are these clear systemic issues that make women more at risk for falling into poverty during hard economic times, like during a pandemic. Things like that pre-existing gender wage gap and access to affordable health care and childcare. So next slide, Kari. So when I talk about NEK Prosper, I'd like to start with this statement that came from a collective impact white paper out of Stanford many years ago. And I always call this our foundational philosophy for why NEK Prosper and how we function as a group. So our large scale social problem, if you want to click return, is poverty and the symptoms of poverty. Socioeconomic status, it's really more than just income. It affects where people live, their occupation, the food they eat, the schools they attend, and how and where and if they connect socially for good health and well-being. So our systemic approach, thank you, is the accountable health community. We are an accountable health community. NEK Prosper was built on the 9 elements of an AHC that was outlined by the Prevention Institute many years ago. But we are not an official entity. We're not a 501c3. We're not funded by CMMI. and we do not function as an MCO or an ACO. So we are built on that framework of an AHC, and we operate under the principles of collective impact. We have a backbone organization and a steering committee, and these action-oriented work groups called Collaborative Action Networks, or CANs. So collective impact, stewardship, I always call that our not so secret sauce that makes it all work. And that's our ability of our members to wear two hats: the hat of their organization and its mission and programs and services and funding streams, and that hat of what's good for the whole community. And then we have our, our shared objectives, which brings us to our shared objectives, which are our communities will be physically healthy, mentally healthy, well-housed, well-nourished, and financially secure. And we have a work group, a CAN, for each one of these action areas. So the next slide is just a snapshot of members of NEK Prosper. We have many sectors and stakeholders represented. And whether you are a decision maker, a doer, or a representative of the community or your organization, there's a place for you at our table. All right, back to you, Kari.
Oh boy. So, as a healthcare organization, Northern Counties Healthcare, as Laural described, we know our population is on the older side. We also know that about 1 in 5 people over the age of 50 are affected by isolation and loneliness, which is a problem that has been associated with a wide range of negative effects, both physical and mental, including higher rates of chronic disease, substance misuse, depression, suicide, dementia, and early death. So during the first COVID lockdown in the spring of 2020, our Northern Counties Healthcare, or NCHC, outreach staff in particular, became very concerned with the increasing sense of isolation of many of our patients, particularly our older patients. And so we were able to leverage our connection to Catamount Arts, our community arts organization, which had been forged over years through relationships with shared projects and collaborations, to engage in a dialogue together about the power of arts to address social isolation and despair and to promote healing connection. So we designed a project together, a pilot project, which is now known as Northeast Kingdom Create Health, using the results-based accountability evaluation framework, which basically seeks to measure how effective a project or collaboration is. So how much, how well, and really ultimately, is anybody better off because of your intervention or your project? And we thought we could set up and design this pilot project to test whether art can be an intervention to help people get through these difficult times and other difficult times, frankly. So the pilot project was modeled on the Catamount Arts Kingdom COVID project. It involved, at a high level, Northern Counties Healthcare's outreach staff to identify high risk or isolated patients who were open to this type of intervention or to participate in this project. The outreach staff would then connect them to needed resources through check-ins, regular check-ins, where they would deliver prompts that the participants would respond to artistically. We delivered materials for them to be able to actually chronicle and work through the experience. And then we set up a measurement tool to survey the participants' needs, sense of connection, life satisfaction, health and well-being before the intervention and during and after the intervention. So that sounds fairly simple. It was well thought out, well planned, and fairly straightforward. However, Vermonters will realize what this represents. This is the thick of mud season, which we're in right now. We got stuck. So in terms of finding participants to actually partake in the project, way more challenging than we thought, especially since these folks are isolated. So it's hard to identify people, let alone those who were interested in participating in something artistic, right? Meeting and greeting participants, really hard when you couldn't do that in person, especially if there wasn't an established relationship and we had gotten the name from one of our partner agencies as someone to reach out to. It's basically like cold calling people and explaining this project and hoping that they would sign up with people that they didn't know. Our incredible outreach staff quickly became very, very utilized in other ways to help people secure housing or to take advantage of other economic benefits during COVID, help deliver food to people who really needed that. So they were super busy helping our patients and community members meet basic needs and had not really a ton of time to do the sort of intensive outreach and connection with the pilot participants. We never figured out the piece about connecting our pilot participants to the rich and large volunteer artists that are part of Catamount Arts Network. We just didn't sort of get there. We hadn't planned the project past 4 weeks, so what if participants loved it and wanted to keep going with it? We had sort of nothing to offer. And then this sort of gallery exhibition or sharing of this material in the participants' like work product was certainly not on the cards. It still isn't, so we're still figuring out how we might share and celebrate the work that is produced. So something which, it was sort of a beautiful coincidence that during the large NEK Prosper group, which meets on a monthly basis and includes all those partners that you saw before. We had been working through something in the previous months called the critical response process. And the critical response process is something that was designed by Liz Lerman and her dance company, which is really a process for giving and getting feedback on a work in progress at any point in its progress. And it's designed really to leave the artist, or in this case, the maker, the project creator, like motivated and ready to get back to work and apply the good thoughts and feedback from others. And it really combines the power of questions with the focus of like informed dialogue. And there are 3 roles in the critical response process. There's the facilitator who initiates each step, which I'll describe in a moment. There are the makers, or the project creators, and then there are the folks who are responders, who are the ones who are giving and engaging in this dialogue and this give and take of feedback and sharing of information. So step 1 is really the maker offering a work in progress, so describing their work. And then step 2, the responders tell the makers what was interesting or evocative or striking about that work in progress from what they just heard. And then it's the maker's turn, this is step 3, to ask the responders questions about the work. And then in answering, the responders can state an opinion if it's in line with the question that the makers have posed to the responders. And then in step 4, the responders ask neutral questions about the work. And neutral questions mean they're questions without an opinion couched in them. So listen to the difference between this. So, hey, why didn't you guys just engage more partner organizations right from the beginning? There's clearly an opinion couched in that question. Versus, what were the barriers to you engaging more partners in the very beginning of this pilot project? So there is a difference there. And then step 5, if the makers are willing, it's sort of an open opinion discussion time where the responders absolutely can ask questions and state sort of opinions about the work. So that's the critical response process in a nutshell. So knowing that the NEK Create Health project was going in front of the NEK Prosper large group to go through the critical response process, it really propelled the project team to think about how they sort of package and communicate the background and the purpose of the NEK Create Health project. It also helped them think about lessons learned, right? And come to the group with really targeted questions. So there was a lot of feedback from the responders that it was a really innovative and powerful example of a collaboration, that they were pleased to be able to dive so deeply into the project, and that they were excited to see where this headed. And then the project group, the makers, were able to think about, well, what are our continued goals? Who are we missing? How do we outreach more participants? Are there other thoughts about other agencies or partners becoming involved? What might that look like? And how might we sustain this program with staffing or other resources? And several other partners and agencies and organizations were so energized by the idea of this project, who were there participating in the critical response process, that they signed up to be part of the project team, and requested really a train the trainer type model, so that they could deliver this intervention with their clients or participants who they already were engaged in relationship with. And one of the participants actually shared that she saw this as a resiliency project, and that there was a grant opportunity that had come up around resiliency in the community. And so we were able to use the notes and the outcome of this critical response process for the NEK Create Health project to successfully apply for this small grant. And we received it, and it really helped expand the project. So it was really this critical response process that was this breakthrough in getting unstuck from where we were. So what had started as a collaboration between Northern Counties Healthcare and Catamount Arts really scaled up then to include community members, our designated mental health agency, our Council on Aging, the Vermont Agency of Human Services, and then the Community Action Agency. And there was certainly a sense in terms of the pilot participants and then more participants who signed up, that there was real meaning to this project, and that in fact, journaling and working artistically through their experience of isolation was very therapeutic and very powerful. In fact, one of the participants went on to say, prior to the program, I was adjusting to living at home alone as I lost my significant other 6 months prior. I began feeling down and depressed and was crying a lot. After participating in the program through journaling, I was feeling much better about myself. I really enjoyed it. So that was Sandy, who has since become sort of a co-designer of carrying this work forward. She just participated as one of the co-presenters in the first Train the Trainer session for our partner agencies. You can see her pictured here with the smile mask. And you can see Jen Grant, who has really taken the lead on the Northeast Kingdom Create Health project and run with it. She's here on the line, so I'm sure she'd be happy to share her experiences or respond to any questions you might have about the project. But it has really scaled up. It's taken on significant meaning for the participants, and we're already achieving more of those is anybody better off outcomes, which included, really deeply involving a community member to be a participant and sort of co-designer of the project. So that was our experience with using the critical response process for Northeast Kingdom Create Health. It's our chance, if you have questions, we're going to sort of practice that critical response process, if you're all game to do that. So we just presented a work in progress, and the work in progress that I'm referring to is our use of engagement techniques as part of our accountable health community. And so now, if you're all willing, if you would just state, what was interesting or evocative or meaningful or exciting about what you just heard. You can write it in the chat, or you can unmute and just say it.
Yeah, I'd love to hear from you all. I mean, I think it's amazing. It sounds like a really helpful process, right? Just in terms of engaging people. So love to hear from our guest here today, if either in the chat or yeah, any questions or comments. So is it Jacqueline? Hopefully I said that right. Jacqueline has a comment. Would you like to speak it, Jacqueline?
Sure, I'm kind of sick, so my voice is a little off.
Oh, no.
But,
okay.
I was just interested in the how structured the critical response process is, which probably made it a lot easier to use in a larger group, I would assume.
It is quite structured. I would say there were challenges to it being virtual. It does tend to flow a little better in person. And you're not having to check the chat and also sort of pay attention with your eyes and ears for people, you know, talking. But it uses those 5 steps I outlined. So in terms of how we prepared the group, a large NEK Prosper group to participate, we sent along sort of the instructions ahead of time. And so here's what to expect. Here's a link to Liz Lerman's website, which talks about the critical response process for those of you who want to sort of dig deeper and learn more. She's written a whole wonderful book about it too, which is pretty cheap and available on her website. And then we did just outline, you know, I play the role of the facilitator, and I had prep meetings with the makers ahead of time to sort of elicit their questions so we could come to the group with questions already planned for the information we needed to gather and the feedback points that we really wanted to make sure that we touched on. So then we just roughly went through, okay, this is what step 1 is. Lori and Ann are going to present the NEK Create Health project. Step 2, we're going to have the responders, that's all of you, say what was interesting or evocative or meaningful. And then Lori and Ann are going to get a chance to ask all of you responders questions. And then you get your chance to ask questions. And then we sort of open it up for opinions and forward discussion. So we sent it out ahead of time and we walked through it briefly. But it was super helpful to get to make sure that the makers understood the process and their role in the process as well. So having that sort of prep meeting before the larger meeting with the makers was good.
Kari, I'm wondering, as part of the resource that I could send out, if you have a link or some kind of information regarding the process. I would suspect people might be interested in that. So that's great. Any other questions from participants, guests?
How many people are involved in this program right now?
Jen, Grant, do you want to answer that?
We had,
Sorry, I didn't.
Hi there, everyone. We had about 5 participants from the Concord Health Center participate in part of the pilot project. And we have now expanded it to those community organizations that Kari mentioned. And there are 5 different community agencies who have now been participating in the training and have all of our training materials to implement it into their own service delivery models.
So we have jumped ahead to responders' questions, but that's okay. It doesn't have to be super, super duper formal.
And Kari, do you do this as a regular part of your agendas, or is it really kind of as an as needed when?
It's an as needed. We concentrated for 3 months in a row and having 3 different projects. Sort of run through that process at the large group meeting, just so we could get some sort of continued momentum and practice. But we've interspersed that now with sort of we did sort of a learning needs assessment of the group and what topics they were most interested in. So we've gone sort of back to different topic areas now. We haven't used the critical response process since, I think this was in December was the last time, but it's always on the table, and folks who participate in those large monthly meetings are reminded, you know, if you have a project, a collaboration, you want to run through this process, please let us know. It's a really great way to get and give feedback.
It sounds like, and what I love about it, like I believe, right, that the table that you're setting in ACHs and AHCs, I know there's kind of an alphabet soup, is just really a space for learning, because a lot of this work is really new. So this, I think, is a great process to be able to make it safe. It sounds like, right, you know, just to be able to share. So I think it's great.
And that's why it's pretty explicit in the critical response process that, you know, opinions, though there is a space and a place for that, really has to be at the maker's discretion, whether or not they're in a place where they can hear those sort of opinions. That's why when the responders are asking questions, it's pretty important to try to frame them in a way that does not have opinion involved, because you're really trying to provide feedback that is useful to the maker without making the maker I get defensive, right? About like, oh, well, yeah, why didn't I think of it? Well, that's sort of, the opinions can be like, well, that's silly, or why didn't you do that? That was stupid. I think they can be very easily interpreted like that. So that's why it's pretty important to try to remove the opinions from the responders. What else?
So yeah, I'd love to hear other questions or comments or reflections. I might call on people.
That's mean.
No, it's not.
I'll say something.
Yes, please.
I just want to say, I just find it really inspiring that through that process, the number of partners grew. And I mean, just to have that feedback and to see how it actually led to the project having more partners was great.
Yeah, and I mean, thank you. It really allowed this sort of coalescing around, like, what do we want this to look like? And really all of the partners came to the conclusion, like, this belongs to the community. You know, right now we have partner agencies involved that are sort of stewarding this work. But like, how great would it be in 2 years' time to be reading about this in the Caledonia Record from a distance and seeing this amazing art show put on by community members as part of the Northeast Kingdom Create Health, right? That we're sort of removed as these service providers. And this really does belong to the community. And it's a different way for people to share their voice and experience that might be seen as less sort of threatening. I think the arts are very, very powerful in that way of leveling the playing field and giving voice to expression for those who might otherwise feel like they don't have a lot of voice in the community. So it seemed like, you know, an unusual time needing an unusual solution. And this is what we came up with. And having those relationships already with these partner agencies through the accountable health community, it makes this sort of work possible, these smaller projects and collaborations possible. Because if these relationships didn't exist already, you know, would we have been able to pick up the phone and be like, hey, Anne at Catamount Arts, what do you think about this? Do you think this could work? You know, it's not as likely to happen if those relationships are not already in place. And really that's what the accountable health community model has allowed us, which is to build this trust. You know, this is years old, that we aren't just starting this up. So it's been forged over years and years of relationship building and trust building. Which again, Bryn, your dad is so much a part of. It's all in the family.
So I imagine, Kari, you've used this like for other projects, right? Like, so it's just kind of something that you're doing. And do you feel like you've had similar outcomes, right? Just in terms of the success of the work and pivoting, I imagine, and yeah.
From checking in with the makers of the previous projects that ran through critical response, they found it extraordinarily useful and sort of just breaking down even a couple of those barriers or thinking about opportunities like differently or that they hadn't thought of or they hadn't connected with, because somebody from, you know, a governmental agency or state agency was on the line to be able to say, oh, have you thought about this opportunity? There's funding right now for XYZ, and this sounds like this could fit. So yes, it has been useful, but in big and small ways.
Yeah, this is Laural. I just wanted to add, I think it just adds to a, you know, really a richer conversation. We often had people from the community come and present on their work or their projects. And it was the typical, they present and then maybe a couple people ask some questions and, you know, everybody leaves and, you know, maybe more informed. But I just feel like this process, it allows for more engagement and just a lot of, as Kari said, learning on both sides, both from the makers and then the people who are participating on the other side, asking questions and offering feedback. I will say the facilitator role is very important because you want to make sure, I mean, there's a time for speaking and there's a time for listening. And you want to make sure that there's a good balance of both.
Oh, and I see you have a link here, so that's awesome. In terms of the resources, yeah.
Yeah. I mean, there's some other tools that we referenced, but this is the one we went sort of deeper into. And I'm curious, what I would like to learn about are other engagement tools that folks on the line have used or could imagine swapping in for the critical response process to sort of elicit the same kind of feedback or you know, break through barriers or when you're stuck. Are there other tools or techniques?
Yeah, would anybody like to share what ways are you in your work and your collaboratives? Are you engaging your membership and communities to get feedback or, you know, just to hear perspectives? I know you're doing it. How about Caroline? Oh, look at that. She was, that was synergistic.
It was. Yeah, I've just been, I referenced the Liberating Structures website quite a bit, just to, especially with Zoom now, I'm finding that some of those structures work really well with Zoom for getting feedback in a way that you're just not like talking at people and then having awkward silence and waiting for feedback. So I'm not really, I don't feel like I'm an expert in any of those, but they provide good ideas for how to mix things up.
What's the liberated? What is like, why is it called that?
That's a good question. I think it's meant to really like liberate and unleash everyone's potential and feedback. I will just put a link in the chat box.
Thank you. Liberating structures. I'm writing it down too.
Yeah, Caroline, it's great. Like I've used those. Those are amazing. And they do provide very nice, like step by step.
Yeah.
Right. Like, ways to do things. So that's great that you're using
We've
it.
done
And
a
have you
couple
found it to
fish
be
bowls.
successful? Yeah.
Yeah. So, and fish bowls, it's one of the formats that we use to try to help partners understand one another's programs. So instead of people coming and presenting with a PowerPoint or whatever, you just bring like people who are working on a similar program as experts, and then they just chat amongst themselves with their video cameras on while everyone has their camera off. And you make it seem like, you're just hanging out at like a coffee shop or something and talking. But you, like somebody said earlier, that prep for facilitation is the most important part. And it does take a lot of prep work to come up with good questions that are going to surface things that people will be interested in. And then once the fishes have had a chance to kind of like talk back and forth, then all the listeners can turn their cameras back on. And then there's a little bit of a question and answer exchange. So we've done one and we're doing another one in April, but there's a bunch of other ones. Like I think it's really fun to explore that site.
But how did you find, Caroline, that went the first time?
I thought really well. And most importantly, the fishes, the people in the fishbowl thought that it was valuable for them too. And we actually did a prep session with them ahead of time, so they really knew what they were walking into.
Yeah.
And we got some good questions that came out of that are feeding into follow-up work. So we didn't send out like a survey or anything to know for sure, but my gut is that it went well, and that's why we're using that same format for another event in April.
That sounds amazing.
Yeah, it just helps people talk amongst themselves. And yeah, anyway, that's all I've got.
Thank you for sharing. That sounds great. It sounds in some ways similar to the critical response process, but I like the sort of informality of the, like, we're chatting sort of, amongst ourselves. Oh, but actually everybody else is participating in a way, and then it all comes together. I like that. What else? Well, I know you guys are doing other stuff too.
I know.
18 users exposed. Okay, cool. Thank you, Caroline.
There is a similar process that we actually used in Vermont when we were there doing the learning lab. It's called the Pro Action Cafe. It's kind of a mixture of a bit what Caroline was speaking in critical response and a world cafe. So you have people, right, that are at tables sharing their project. And then, they're getting feedback, but you rotate around. And then there's a silent round in that where the, I guess the maker, in the critical response has time to reflect and then kind of then share back. This is what I heard and this is what I want to do. So I think they all, like, what I just love, I'm going to just repeat, like creating a space that is safe, right, for people to come and share, because oftentimes, people might feel isolated and feel like in a bubble and you have to figure it out on your own. And so creating that in your ACH, AHC multi-sector collaborative is amazing, because it's for the betterment of everything you're doing together. So it's pretty amazing. So love it.
And I think that if you're involved sort of in the nitty gritty and hearing about, like, what are the challenges, what are the questions that the makers have, you feel a sense of ownership in a way you wouldn't just hearing somebody present about it.
Yeah.
So you're more keenly tuned to, like, the progress and, oh, yes, I remember that. Yeah, I wonder if we could do that at our agency. It's just a deeper connection to that work than if you were just sort of a passenger.
Okay, any other comments, questions, reflections? I'm gonna go try that tomorrow.
I usually over prepare content. So usually we'd be running way over. So this is amazing. People have the gift of time back.
Yeah, that's right. You've got a couple of minutes here. Well, thank you. I'm very grateful for you, Kari, and for Laural. I know she's back. She was having a little bit of troubles, but thanks so much. And then for those of you, I think you all registered because you're here today. We'll be sending out the recording as well as the slides very soon. So thank you, and look for more of these stories from the